I suppose we could start off with yourself. How long you've been doing Trigenics and how it's impacted your practice and in your life, and then maybe a case study after that.
Okay, sounds good. Okay, well, first, I've been in practice for 38 years, and we've always done a lot of extremity work. We would do just general manipulation of the extremities, and it's been about 4 years now that I took the first class with Dr. Allen, where he did the shoulder and did the knee. Well, immediately, the knee was easier for me to master, so I came back and started implementing the knee the very next week on patients who were having difficulty, because most of my practice was more of a classic chiropractic practice, people with low back, leg pain, that whole lower extremity. So we started with the simple moves of the popliteus, and then the front doing the patella tendon. And immediately I had patients that were able to stand up, bend their knees, walk better, and it was kind of like a miracle. I mean, I had patients that I've been treating, doing other techniques and therapies, and they would respond a little bit, but nothing like this. And I had patients just say, this is an absolute miracle. And I can't even begin to tell you the number of patients that we've attracted with knee pain. I've had patients who were in wheelchairs that with just one treatment, Pete, they were able to stand up, bend their knees, and walk. Now, they weren't walking perfectly, but they were able to walk. I had one gentleman who has done a lot of testimonials for us. He was grossly overweight, came to me on crutches with knee pain, and he was so bad we couldn't even lay him down on the table to do the technique appropriately, like Dr. Allen teaches. So I had him just stand up because he couldn't lay. He stood up, and I just worked the Trigenics maneuver on the back of his knee standing for 3 days in a row, and each time he could bend a little more, get to bend a little more, to finally he was able to walk with that. It took us about a week. He was able to walk without the crutches, and we were able to put him back on the table prone and supine to do the complete treatment. And he sent me lots of patients. It's just a miracle. So it's absolutely, I can't even begin to tell you. When patients come in, it give you a confidence. I mean, you can almost, after you've done this a while, as long as I have, when somebody comes in with knee pain, you can almost tell them, guarantee that this is going to be, life-changing. It's going to be a miracle. And when they stand up, they say, oh my God, I can't believe how much better that I can, bend my knees and move. So it's pretty impressive.
So you're obviously charging a higher case fee for these procedures then?
When we started, we had a case. We've always done for the past several years a case fee. In my area, we have absolutely no insurance. A lot of people just don't accept insurance. Well, I ended up not accepting it just because we don't have it anymore. Mm-hmm. And so we just started doing a case fee for the procedure. And typically, of course, if you do a good comprehensive neurological exam, most of these patients with knee pain, a large portion are going to have, numbness, tingling in their feet. They're going to have maybe some symptoms of neuropathy. They're going to have some muscle weakness, maybe some nerve weakness. So we'll do a combination of the Trigenics. We'll do some laser therapy. Sometimes we'll do some other therapies like Rebuilder. We also have a pulsed electromagnetic field therapy, which has been beneficial. And all those therapies are helpful, but they are only secondary to the actual Trigenics to the knee. Matter of fact, I have a lot of patients that say, listen, Doc, I don't want you to do these therapies while they feel good, but the Trigenics is what helps me the most.
Wow, that's great to hear. Now, I remember we spoke previously, and you had mentioned, I think, correct me if I'm wrong, but I think you mentioned that in your first year, you've seen your practice income increase by a few $100,000 that year.
I would say, and I don't have the exact stats in front of me, but I bet you we were able to increase between maybe $250, almost $300,000 just by treating people with knee pain. Now, we did it because we marketed knee pain with, newspaper, and we had pretty heavy newspaper presence. And then we would do some Facebook advertising. But I mean, a lot of it was just old-fashioned referrals. You know, if you help somebody with knee pain, and a lot of patients they want to do surgery on them, but because they have such poor health on so many medications or have weak hearts, the doctor said, I can't do surgery. And then the patient would, this was their only option. So referrals, advertising has really made it, really helped add a different niche to our practice.
And I assume it's been continually going up since then too, right?
Correct. Yeah, we because what I usually try to right now, I try to do more niche marketing, and we do peripheral neuropathy, knee pain, plantar fasciitis, but I use the Trigenics mostly for knee pain. I do use the Trigenics moves for the plantar fasciitis, but the knee pain is by far the best. My next goal is to learn the shoulder. I've taken the class, but I haven't mastered the shoulder yet. But that's my next goal is to master that and then add that into my practice.
Yeah, the shoulder is a very popular course for sure. I guess just to finish off here, what would you have to say to any health practitioner that would be considering to take Trigenics? What would your advice be to them?
It would be the biggest mistake you ever made not to learn how to do the Trigenics procedures, as I said, especially to the knee, because you can do, your whole purpose should be to change patients' lives. And I've been doing this for 38 years. A lot of my friends have already retired and cashed in, but honestly, Pete, I love getting up every day, still coming to work, and knowing that I can do something to make a difference in these patients. It's fun. It is absolutely fun.
I could tell that from the tone of your voice. That's apparent, and from the conversations I've had with you before. Wow, that's just amazing to hear all that, because I hear it a lot here, and just to hear it again and hear the impact that it makes, it's wonderful. I don't know if you could even add anything to that, because that's just amazing hearing your story.
Yeah. So it's a wrap.